Hi, everybody. Welcome to session 355, the Radioactive Iodine Roundtable discussion about management of side effects, as well as safety guidelines for after you leave the dosing center. It is my true pleasure to introduce Dr. Anupam Kotwal. Dr. Kotwal is an endocrinologist and assistant professor in the Division of Diabetes, Endocrinology, and Metabolism at the University of Nebraska Medical Center in Omaha, Nebraska. His clinical focus is on endocrinopathies from cancer therapies, thyroid nodules, thyroid cancer, and adrenal cancer. He himself was diagnosed with thyroid cancer, which has provided him with a different outlook toward caring and empathizing with his patients. Welcome, and I'm going to hand the microphone over to you.
Okay, thank you so much for this introduction. And thank you to ThyCa for organizing, the whole conference, and it's been great being here. I will just maybe provide a little bit of my input on the topic that was provided, and kind of we'll have some questions. We'll open it up. I don't have any particular slides, so I guess you'll have to look at my face during this during this session or recording. All right, so when we think about radioactive iodine, and so the timeline we're talking about is you've been given that radioactive iodine dose, and what happens from there, right? So most of the radioactive iodine we're giving people now is in the outpatient setting, so in the office or the radiology suite. Previously, it used to be a lot of people would get hospitalized for radioactive iodine, and again, the doses were higher, but that's not the usual now. Now, there could be instances where doses a little bit on the higher side, maybe close to 200, or we're doing what we call dosimetry, so kind of this calculation, especially in people who may have kidney issues or other illnesses, older age, or multiple metastases, where we're kind of trying to make sure that we don't give a huge dose to the lungs if there are multiple metastases and cause fibrosis. So those are instances where people would still be admitted in the hospital. There have been instances, and some of my own experience with patients, where if someone doesn't have any support at home, maybe they have issues with housing and they could not isolate from people for a few days even, then also we would have them in the hospital to kind of really provide them the ability to isolate from people a little bit, and things like that. So so I'll talk about more when you're going home, and the similar thing would be kind of overlap when if you were going home from a hospital room. So usually when we go home after we get that radioactive iodine pill, or liquid, usually it's pill in most cases, we would want the patient to stay away from others. And so the question is how long and how much distance. So there's a time component and then there's a distance component. So usually we say try to maintain at least 6 feet or 1 meter away from people. And when I guess when I had my own radioiodine, it was in the middle of COVID, so this whole 6 feet thing was pretty easy. We were already isolating with people from people for 6 feet. The other is time, right? So try not being very close to people for more than 20 to 30 minutes. And this time is cumulative. So if you're spending more time with the same person, that their risk of being exposed to the radiation goes higher. Now, the exact numbers change. It's going to be different for different people. It somewhat depends on how much uptake happened in your thyroid gland and how quickly you will clear that. So the usual is, at least for the first 3 to 5 days, try to stay at least 6 feet away from most people, especially if they're children, pregnant women. So, groups that their thyroids, if they're exposed to radiation, they have many years to then develop cancer, as opposed to kind of adults where yeah, you should still try to stay 6 feet apart. But if it doesn't happen, especially if you have a caregiver who may need to come a little bit closer to you for a short amount of time, that's still okay. Try to limit that time to less than 30 minutes. And even in that case, try to maintain at least 3 feet apart, right? So someone's handing food or something, try to maintain at least 3 feet apart. So the first thing is when you're driving back, well, do not use public transport, because then it's hard to make that separation. So if you're driving or someone's driving you, if they're try to kind of sit, if you're in the passenger seat, or if you're in the driving seat, the other person should be in the back passenger seat. And that gives at least 3 to 4 feet. If you have a bigger car, maybe they can kind of sit even back further. But if it's for a short drive, 30 minutes to an hour, that's okay. Just keep in mind that that caregiver has now had a little bit of exposure. So maybe they should not be all the time involved in kind of caring for you or being very close to you. The other thing is fluids. So most of the radioiodine will be excreted through our fluids. So, the dishes being washed separately or flushing 2 to 3 times after you go to the bathroom. For men specifically, if you're going to pee, sitting and doing that, so it's not create a lot of splashing. And again, so these things, the fluid aspect, at least 1 week of precautions, but to be safest, 2 weeks. So, the flushing twice, 2 to 3 times afterwards, at least for 2 weeks after your radioactive iodine. The other thing with precautions is, so you'll go home. You don't have to completely isolate from people, right? So if it's a big room, you could sit 6 feet apart from another person in the same room. Just try not to kind of touch things and hand them over, or a remote, because if your hands are sweaty or you had some saliva, don't kind of hand those things over. But if you're 6 feet apart, that is okay. The thing with children is that, that's kind of more to be more careful, because sometimes they will not follow this 6 feet rule and they may come and jump on you. People ask me about pets and I tell them, well, treat them same as you do your children, right? Especially for this. So the, similar kind of scenario. So I get asked that sometimes. So we can come back to the whole distance and precautions thing. And most of these are for the first 5 to 7 days. Usually what will happen is when you go for your post-therapy scan, usually around day 7 to day 5, sometimes day 10, that's when we can kind of ascertain how much more do you need the precautions. Usually after that time, we don't need these strict precautions. So usually after day 7, we don't need these strict precautions, except for the fluids part, which kind of should go on for 2 weeks. Then the other thing is side effects. So early on, immediately after you take that radioactive iodine, you can have nausea, you can have vomiting. So usually we'll tell people, try not to eat a lot that time. So we'll say, if you're getting your dose sometime during the day, maybe 4 or 5 hours before that you can eat, but then don't eat within that 4 to 5 hours. So we don't want you to kind of vomit that radioiodine up. Sometimes we'll also give people like an antiemetic like Zofran, or at least have that on hand if you start developing those issues. Some people may have nausea, diarrhea. Usually it's temporary, and usually it's in that first day after you get the radioactive iodine. And then hydration is important. And this kind of guideline on that has changed a little bit. When people used to get much higher doses, there used to be much more nausea and vomiting. So would say, decrease your fluid intake, but we don't do that as much now. So prior to the dose and 3 to 4 hours after the dose, we say, don't eat anything, don't drink. They'll give you a glass of water to have that pill, but don't drink much more fluids. But after that 4 to 5 hours after you've taken the dose and you're feeling okay, start drinking fluids, because this is where the radioiodine should have been gone to wherever the cancer is or your residual thyroid. And then you want to kind of start clearing it off. So the evening off, and so for the next 24 hours, we say keep well hydrated, keep drinking fluids to the point that you're going to the bathroom to pee every 3 hours, and it's clear liquid. Okay, perfect. Yeah, so interrupt. So I'll stop and yep.
Okay, we're sharing a mic here, so we're going to go back and forth with the microphone. First question, how long to stay away from an 8.6 pound pet and a 10.6 pound pet? Very specific pets. For is it 2 weeks?
It can be the first usually 3 to 5 days, at least until you've gotten that post-therapy scan if they're doing it. Does not have to be 2 weeks.
Okay, the other question, what if you have diarrhea after taking the radioactive iodine? Does that mean it's escaping the body too quickly before it has a chance to be absorbed in the body?
No, only vomiting, if you vomit it out, would be the concern. So diarrhea would just mean that your gastrointestinal tract is seeing that as like a load or a heavy load. And so it's just kind of reacting to that. But it doesn't mean that, the radioiodine is still being absorbed. So it's just a matter of kind of either waiting. That's the other reason we tell people not to have very heavy foods. So if that's that day after you gotten the radioiodine pill, it's still light foods. You're still kind of finishing up that low iodine. You're still on that low iodine diet, right? So either way, it's not very, very heavy foods. And to reduce that fat content, usually we're able to prevent or decrease the diarrhea with that.
We have another question. I hear a lot of different information on sour candy after therapy. Can you give your opinion on usage, timing after treatment, recommended products, etc.?
Yeah, that's a great question. So I've looked into this, and some of it is after my own kind of personal experience, but we get asked this. So answer is we don't know exactly what timing is great. There was a study done where they compared people who got sour candy immediately after they got the radioiodine, and the other group who started it like a day later, so almost 24 hours later. And really, the one that started a day later actually had lower likelihood of having kind of decreased salivation or long-term having any sialadenitis, which is inflammation of the saliva glands. But these groups were not exactly the same. This was also a look back as opposed to following patients prospectively or moving forward. And the group that had the candy a day later actually had a little bit closer questioning and monitoring for some of these side effects. So the answer is we don't know for sure, but based on this work and the fact that early taking sour candy doesn't do much. The other thing is we do want to give the radioiodine at least 3 to 4 hours to kind of go and attack thyroid or thyroid cancer. So in most cases, we're starting sour candy the next day. So you don't have to wait exactly 24 hours, maybe it's 18. So start it from the next day. That's what at least I'm doing in my practice. But starting fluids and being good about doing a lot of fluids around 3 to 4 hours after you've taken that radioactive iodine. So on this taste and saliva thing, then we have the dryness of that, but there can be dry eyes, and some of it is a little bit unclear. It could be just generalized dryness. Some of it could be maybe uptake in some cases. The eye issues were usually with much higher doses, or if you're getting your second dose, right? So second or third dose of radioiodine, if you've needed it, these side effects are almost always more with that. They're still less likely and usually manageable with the first dose. Dental care, yeah. So I thought about dental care, and again, with the saliva issue, if you have mouth dryness, your dental pH will be affected and you're more at risk of caries, etc. So we say, make sure you visited with a dentist before. You don't need like a clearance, but make sure you have decent dental hygiene. And then following that, I just tell people, listen, if you are not brushing twice a day, flossing, if things get stuck, well, now you have to become that person. So keep a brush at work, keep a floss at work. And especially in the first 3 months or so, when there is a little bit more dryness, things may get stuck. And, it may not be that big a deal, but, whatever we can to prevent dental issues or dental caries is better. There have been times when people have had to switch from like the typical toothpaste that we use to ones that have less, like the kind of just a mineral base, or the ones, same thing for mouthwashes. So as opposed to the alcohol containing mouthwashes, which by themselves can dry it out, use the ones without that alcohol. And so you can get it from like just generic pharmacy brands. You don't have to get anything super expensive for that. What else do I have here? Yeah.
So a follow-up question to the sour candies, and this question is from me. It's not from anybody being submitted. Dr. Van Nostrand was saying in his session that salivation is what's important, not necessarily sour candy. And he suggested everything: chewing gum, eating food, thinking about eating food, which can make you salivate, all kinds of, kind of whatever it takes. And then I've heard conflicting information on the sour candies. Some people say it can damage the mouth tissue because of the acid. And other people swear by the lemon head. So do you have an opinion?
So as to the first part, yes, anything that increases salivation. We do know that sour things, sour foods, lemon, etc., do increase salivation. So maybe that's where the whole sour candy thing came up. And also we know that initially people may not have as much appetite. They got, they've been made hypothyroid a little bit, and now you got radioiodine, you already have some bloating, etc., or nausea. So maybe people will have trouble thinking about food. So that's why this, the sour candy may help. So yes, there is a concern if we keep doing sour candy for maybe like weeks after radioiodine, does it start kind of affecting your tongue tissue and make it drier? And I think it can, and that happens like for other reasons too. So really it's the first, few 3 to 5 days after radioiodine. And you can see, I mean, if your mouth is kind of gets saliva, you're having saliva in there, yeah, it doesn't mean that you have to keep popping the candies. But so really in the first 3 to 5 days is where we say, have a candy every 3 to 4 hours, and make sure saliva stays there. Make sure you're having some, water as well to keep it moist for the salivation. But yeah, longer term use of these sour or candies can, and again, I don't know if there is a research study on this, but personally, I took these sour candies a lot, and then even a couple, because you get used to it, and some of them they're kind of tasty. So then you're like, oh my, why is my tongue getting so dry? And it could actually cause some of that. Again, fortunately, none of these things are long term, right? So if you have more sour candy for a short term, yes, it can kind of corrode that kind of lining of the tongue, and you'll feel a little bit of that, but it'll get better. So fortunately, it's not a permanent thing.
We have a lot of questions popping in. Do you recommend isolating after a tracer dose to test the uptake?
No.
Okay, that was an easy one. Is it typical and usual that you'll have long-term dental consequences to RAI, or generally are people okay, assuming you get a normal dose, not too high millicuries? Are dental problems something I should be expecting after radioactive iodine?
No. So generally, if you got not your second or third dose, not a super, super high dose, then dental problems are not an issue unless someone already had poor dental hygiene from before. But otherwise, it's not a major issue. But again, I think it's not a major issue because we ask people, and fortunately, our thyroid cancer survivors are involved in their care and can follow kind of advice and instructions. So most of us will have good dental hygiene. So maybe that's why it's not an issue, but not a major issue.
This one is interesting. What is the risk to losing my hair after radioactive iodine?
Yeah, so I don't know if it's linked to radioactive iodine. It could also be linked to the stress of the surgery, stress of being diagnosed with thyroid cancer, right? We know that hair loss happens very quickly with that. We call it telogen effluvium loss of hair loss, hair diffusely in that setting. It can take months or years to get better, or never. Being made hypothyroid, and even if your hormone levels are okay, we do know that taking thyroid hormone and being euthyroid on that versus having your own gland are not the same thing. Radioiodine does have some uptake in the hair follicles. And there have been cases where that's been shown. Sometimes it can have a little bit uptake. Some of it could be, and the sweat, right? So the sweat will be happening through the head, and that can be there too. We don't know how much of it is linked, particularly with radioactive iodine. So I don't know if there's a comparison between that versus people who did not get radioactive iodine. But the thing is, people who do need radioiodine do have a slightly more aggressive surgery because their cancer was something that would require radioiodine. It spread to lymph nodes, etc. So I don't know if it's just that stress to the body as opposed to a partial lobectomy, or is it radioiodine? Not sure.
Great, great. Now we have two questions related to the low iodine diet. I'm going to try and combine them. What is your recommendation for timing of the diet prior to therapy? 2 weeks, question mark. The other question is about how long after. Should you stay on it 1 day after, 3 days after? They've heard both. And another part of this, which diet specifically did you follow? The ThyCa diet or the low iodine Facebook community? Some are a lot stricter than others.
Yeah, so for the first question, and this different practices may do it differently. Most people will need around 2 weeks of low iodine diet. So the way we do it is starting about 11 days before and then finishing up 3 days after. So it's total of 14 days, but it starts 11 days before and then finishes, you get the radioiodine, that's day 12, and then you finish it 2 days, take it for 2 more days after the radioiodine. Now, does that matter? What if you are not great after you get the radioiodine? You kind of, have some iodine containing foods. We do not know. We don't have studies on this. Again, I don't think we will do studies on this because, we want to give the best outcome to people. It has been shown that being iodine deficient increases uptake of radioiodine. Whether it's 2 weeks or 1 week, we don't know for sure. Now, there has been some studies. There's one where they made patients deficient for about a week, and that was able to get the urine iodine pretty low. So I don't think you have to do it for full 2 weeks. What we chose is, well, let's do 10 days before, 10 and then or 11 days before as a kind of a middle ground between 2 weeks or 1 week before. But 1 week may be okay. And so because of that, the second, chimes into the second question of how strict you have to be. I tell people it's a low iodine diet. It's not a no iodine diet, right? So read the handbooks, and it kind of depends on, again, how much information you want. I personally use the ThyCa one because we use that in our clinic. We use the book, give the booklet to people. But within the ThyCa booklet, again, you have that list of all the foods that give you exact content. Do you need to know that? Not always. If you really, really want to, I think that's okay. But then there's this easier part, which gives you kind of this breakdown of foods like breakfast, lunch, dinner, and makes it fairly simple. Like if you had your 2 eggs for breakfast, maybe you're not eating many eggs later, or you had your 1 chicken breast, then you eat something else, and it makes it very simple. So I don't, I think I go by how the person is. If they've read about diet, if they're very particular, then they can get all the information and be very, very strict. We don't measure urine iodine, and the reason is it takes about 10 to 12 days for the urine iodine result to come back. So it will not change what we do. But that research study did it kind of retrospectively. They measured it, they still treated the people, and 1 week of strict low iodine diet was enough. Now, none of us, and that was a research study, so none of us probably can do that strict of a diet. And so that's why we kind of just say, well, maybe 10, 11 days prior of a low iodine diet before radioiodine will overcome some of the usual times we forget having iodine-rich foods. I mean, I had some couple strawberries at a dinner 3 days before my treatment, and then I freaked out because that booklet does say it has some iodine, and it has some, I think, and so then I was very strict for the other 2 days. So that's something.
So the 9th edition of the low iodine cookbook will tell you that strawberries are totally fine. So that's an older thing. So I am going to stay on this question because she's asking specifically about the ThyCa diet versus the low iodine Facebook, low iodine life, I think they're called. I don't know if you know about that community, but they're a community that does research on food manufacturers and asks them if they allow for iodine-free salt. Whereas the ThyCa approach is, if it says added salt, we assume it's iodized no matter what the food manufacturer says. So obviously one is a lot easier to follow because you can have manufactured foods, and the other, the ThyCa diet, is a bit stricter, but yet easy to follow with the cookbook. Do you have an opinion?
So my opinion is that if you have other things going on, if you're have taking care of family, you have a job going on, and you have other things to do, how much time and effort can you put in this, right? And so to kind of get, yeah, I mean, if you're getting to that the group and they've asked the manufacturers, I mean, I think from a person, so if you're asking my personal opinion, my preference is, well, if we have, it's somewhat easier to remove some of these foods which could have some iodized salt, because it's only for maximum of 2 weeks. It's not there's I think if there's other things that people have to go through. There's forms of thyroid cancer where people are getting radiation treatment and whatnot, and then I think of it as like, maybe this is a little bit healthier for me. I've actually made some changes in my food choices after going on this on the low iodine diet, decrease the amount of processed and canned foods I eat. So that's how I took it. I think that's my personal opinion.
Yeah, I think that's great. This question: what was your personal experience with radioactive iodine, and what were your side effects?
Sure. Personal experience. So some alteration of taste for maybe 3 months. Decreased salivation for which is 3 to 4 months. But as I have to, I don't know. It's I do have to take sips of water or fluids every 2 to 3 hours. But I also had a little bit of dry mouth from before, so hard to say. It just feels maybe a little bit more pronounced. Did not get silenitis till now, but we know sometimes it can happen a couple years later. So fingers crossed there. Yeah, but no, nothing else. I mean, the taste has returned to normal. I never had a very advanced taste palate. I was not like judging food competition, so probably that's fine. And no worsening of dry eyes or anything like that. Yeah. Yeah.
So this question is actually targeted at both of us. It says, from your personal experiences, both the moderator and Dr. Kotwal, from a scale of 1 to 10, how bad is that isolation period? Number 1, a walk in the park, and number 2, the worst experience of your life. It says, I'm worried about having very bad nausea and other harsh physical symptoms response. So I'll answer super quick. I had like 0 issues other than I sucked on so many lollipops and drank so much water that I gave myself a sour stomach. Once I backed off that, I was totally fine. Back in the day, 27 years ago, I was hospitalized, and I enjoyed the time away from life and read some books and relaxed. So that was my experience.
Yeah, I think it's somewhere in the middle for me between those two extremes. So I did not get hospitalized. I was at home, but have a 2-bedroom. My parents were staying with me, so they would stay in the other room. I don't have any pets, and my mom was making Indian food, which is great, and apparently the rice doesn't have iodine, so it worked out fine. But I hear that, I mean, if you have, who's gonna make the food, who's gonna make sure what we're doing, and we did measure some of those things, because if I thought I'm eating something that may have iodine, I wanted to make sure I've measured that. Physical symptoms, really, besides just some of this taste issue and salivation, temporary, nothing happened. Some nausea on the first day. Yeah.
Yeah, I guess I did have some taste issues, but mine kicked in later. Like after I was released from the hospital and got home, and like 3 or 4 days later, then I had funny taste, and after 2 weeks, it went away. In most of the world, inpatient treatment is required for any I-131 dose of 15 millicuries or more. In the US, it's routine for patients to get 200 millicuries or more and send them home, even when there are children in the home. Does that concern you? Likewise, patients often go to hotels after treatment. Does that concern you? Thirdly, patients often have no choice but to take public transportation after treatment. Does that concern you? And if not, why?
Yeah, so as I had said earlier, sometimes there are factors where we think they cannot isolate. I would recommend hospitalization for that, and we've, at least in our practice, have done that. 200 or more, we usually would recommend hospitalization. So I mean, I would check with, and clearly, we ask if you cannot isolate from children at home, if there is no way and you'll be there, then yeah, then we would ask that you get hospitalized. So yeah, please, try to work with your team to make sure that you've conveyed these issues. And if there's no way to take care of them, then you need to be hospitalized for that time. Yeah, I mean, so hotels. So when I trained at Mayo, and people would travel overseas sometimes, right? And so they would then stay at the hotel for that 5 days at least, get that radioiodine scan, and usually after that they're okay. So yeah, you don't want to expose. So in the hotel, people should be aware, at least over there, the hotel people knew that these are patients staying in the hotel. Flushing, not using disposable silverware is the other thing I get asked that too. Do I need to wash it? Can I just use disposable? Well, disposable, you're going to put it somewhere, and maybe animal gets to it, or some homeless person or whatever, and it's not cleared enough. We don't tell people, if you can, please wash the utensils, as opposed to using that disposable initially, at least for the first 5 to 7 days. But hotels, I mean, if people are aware and you're kind of isolating in there, and you're not sitting in a busy restaurant surrounded by people, that is okay. And again, most of these precautions are in that first 3 to 5 days. So I think the hotel is okay if there is no way that you can stay at home and you cannot stay in the hospital either. Yeah, we recommend that you do not take public transportation, at least till you've had that the scan at the day 5 or 7. So if there are people who need, so usually I've had patients who that's their only way to get to work. And so in that case, we say, well, then you either work from home or you stay at home, and do that, because then you're kind of exposing people who are sitting right next to you. I think, and this is kind of when you think about other people as well. Now, 20-minute bus ride sitting next to an adult, we don't know. We don't know what's going to happen. Maybe that person has had some other radiation exposure, and then you increase the risk. We don't know, right? So if you don't know these things about the people, we ask them not to use the public transport, at least in the first few days.
Can I wait more than 4 or 5 hours to start drinking water to give the radioactive iodine more time to work on my cancer cells? Or does that put me at risk for salivary gland damage?
We don't know. At least I don't know. It used to be that we would tell people, don't eat or drink anything that almost that whole day till like your dinner time. So you get your dose at 12 p.m., start eating and drinking at dinner, because we were giving bigger doses, and there were higher chance that you would vomit it out, and that would not be good. Now, these issues are not much. We can give you anti-nausea medicine, things like that. So we don't think there is a need to wait more than 4 to 5 hours. And that's been shown by studies showing like how much time it takes for the radioiodine to be taken up. So it doesn't need more than 4 to 5 hours. Now, if you wait a few hours after that, what if you napped? What if you were so tired and you slept and you wake up 5 hours later? Probably okay. Just drink during that time. Make sure you're drinking, in the evening and night. If you wake up, have some water. We don't know if it increases your risk if you wait longer than 5 to 6 hours. There's at least I don't know of it, but you don't need to, basically.
So you mentioned vomiting. What if I vomit after taking the pill? Do I get immediately redosed or rescheduled for another day? And this particular person tends to dry heave randomly or when they're nervous.
Usually we cannot give you this dose the same day because it takes a while to be prepared and to be brought to us. So usually what they'll do is give it to you again. The problem is we don't know how much you absorbed. So if you absorbed some and then you vomited, they probably will still ask you to do the precautions. And so it creates a very issue. So we could then kind of follow you, see how much radioactive you are. But this does create issue. I've not dealt with this in my practice, but it can create an issue. So we cannot redose you on the same day, from my knowledge. And then, yeah, so if you're prone to these things, then take Zofran before. So I had patients who say, I kind of have this, or they have other GI issues. We just dose them with Zofran 3 to 4 hours before the radioiodine. Give it every 6 hours that day, at least, 3 times a day. And they do just fine. So if you have a risk of it, tell the specialist that you're seeing. You may even need medication before the dose.
So this one is about the cleanup. Can you go into detail on cleanup after your isolation period? It's a bit confusing. What needs to be cleaned, avoided, the time? This person's heard 90 days for things that can't be cleaned. And then do you clean with just water and soap?
So I presume this is cleaning things and supplies around the room and the house that you've touched. So regular, like whatever disinfectant you use is just fine. Maybe not just water. The key is that the radioactivity in, like, so for example, you had saliva or sweat that then stuck to a TV remote, right? And how long is that remaining radioactive active? You don't have to do for 90 days. Usually we say that most of your kind of secretions have cleared the radioiodine after the first 2 weeks. So anything that you're touching after that is okay. Now, things you've touched before that, if you've cleaned them with a regular disinfectant and you didn't touch them again, then they're okay as well. So I guess the way to look at it is, it's been that 2 weeks, whatever sheets you were sleeping on, covers, things around the house that you've touched, your bathroom, those should be cleaned. And then once it's happened, after that 2-week point, then you're okay. I don't know if 90 days seems to be too much.
I know that I've read that you should avoid using bleach because it can aerosolize the particles. So we usually, I know from a ThyCa perspective, will recommend that you can disinfect with like soap and water and alcohol and things like that. But we usually say to avoid bleach. Is it mandatory to take precautions like covering your mattress, pillows, electronics with Saran wrap? I'll just let you know that back in the day in the hospital, everything was covered in Saran wrap. My mattress was covered in hefty bags that had been sliced open. It was quite the scene.
Yeah, well, if you have sheets, usually we think, if you sweat, it stays in the sheet. If a little bit goes into the mattress, it's not going to be radioactive after 2 weeks. So I mean, if you Saran wrapped something, make sure no one else is touching it if you are actively touching it, right? Otherwise, that Saran wrap needs to be cleaned. But if you're the only person who's touched it and it's been 2 weeks and then you remove the Saran wrap, then I guess you prevent having to clean the remote. But I I think you can, if you're okay using just regular disinfectant at home to just clean the things, because we can't Saran wrap almost everything. So I don't think there's a reason to do that, especially because we know cleaning is fine. Either way, it's good to find a reason to clean your apartment and house and whatever. So maybe you can use that. I don't see a reason to use Saran wrap for anything.
So this question says, I've heard recommendations to shower twice a day during isolation. Is that necessary or recommended? And I can, just from a personal experience, since I was hospitalized, had nothing better to do, I took nice, hot, steamy showers twice a day, figuring I was sweating more out.
Yeah, so this is a good question. Again, in the first 3 days is where most of that fluids, including sweat, releasing, has some radioiodine. I think it's good to shower twice a day. I don't know if it's absolutely necessary, but it'll clear off that sweat. So then it sticks less to the sheets and things like that. And so if anything, in the first 3 days, I think it's a good idea to kind of rinse off. You don't have to do like a full thing, but at least rinse off twice a day. I don't know if there is kind of a studies to say one versus the other, but yeah.
Sounds like it certainly can't hurt though, right? If I wear glasses, eyeglasses, am I washing my glasses for 2 weeks? And the same with jewelry that you're wearing.
I mean, if you're wearing it and no one else is getting into contact with it, that's fine, right? Technically, you could, it's just on your body. Now, yes, it should not get reabsorbed, right? So if your sweat touches it a little bit, it'll dry off. That radioiodine will not get reabsorbed. So you don't need to, unless it's coming into contact. The key is that before that, after that 2-week mark where we know that we don't want anything on there, then definitely clean all the things that you were wearing or in contact with. But until then, I don't see a reason to keep cleaning it, because you're going to put it back up again. And yeah.
So this question, do you risk re-exposing yourself while you're in isolation if you touch things that you haven't cleaned? You know, like you're playing with the remote and the next day you're touching the remote, and like, are you re-exposing yourself? You could, and you know, can you drive yourself crazy washing everything every time you touch it?
You can drive yourself crazy, so that's what right. I mean, you would not re-expose yourself. You know, the big dose of radioiodine kind of goes in, gets absorbed as much as can, and it's coming out. The amount of re-exposure that would happen is almost none to minimal. So you already are radioactive from inside during that time. So there is no like re-exposure. So for example, if at that 2-week mark you had sweat on some jewelry and it touched you, it's not an issue. Just clean it off, shower it off, and then you're good. So I don't think you have to go super crazy about washing all the things all the time. The key is if they're coming into contact with people during that time, that is an issue. If not, you can wait a little bit and make sure you've done it at the end of the period.
This is an interesting question. Would an elegant way to deal with this is to just wear a disposable Tyvek suit 24/7 and change it once a day and throw it away?
If a personal preference, you don't need to. I mean, if you wash clothes separately from other people's clothes in detergent, they're okay. And same goes for sheets, separately from the sheets that others are using during that initial 10 to 12 days, you're okay. The thing with the disposing is then again, right? You dispose it, whoever gets exposed to it then could be at risk. So this is again caring for people in your own household, but then also people that you have no relation with.
I know I put my garbage like in the corner in the garage and let it decay for a couple weeks before I threw it away. And I figured it couldn't hurt. Should we use, this is a good question. Should we use a new batch of personal care products like toothpaste, lip balm for a couple weeks and then throw it away and buy new? Are we allowed to wear makeup? And like, if we're using makeup brushes and whatnot, do you have to throw that stuff away?
Yeah, that's a good question. I don't think you need new ones initially, but I would, yeah, at least for like toothbrushes, like throw them off after you're done. So you don't need to get new ones, but after you're done, then you start using a new one. Same goes for, I mean, toothpaste, you don't need to unless it actively touches that toothbrush. Yeah, same like brushes that you're applying a lot on the face or areas that sweat could go on, and there is not a good way. Now, if you can wash them nicely with soap and water, you're okay. But if that's not possible, there may brushes that go bad with that water, then get new things kind of afterwards. Soap, again, this whole soap thing does somewhat get attached to soap. So if you're using a bar soap, just get a new one after the end of that period.
If you had a baby or a toddler, would you recommend waiting even longer than 2 weeks to kiss them, share food, etc.?
There is no data to suggest that after 2 weeks you need to, unless you were, you got hospitalized for a much higher dose, where the radiologist will tell you at that post-therapy scan how much more you need. But otherwise, 2 weeks seems to be a good kind of a more than enough time point, where after that we say people who are more at risk, pregnant women, children, toddlers, um, they should not, there should not be an issue with contact with them after 2 weeks.
When you tell a patient with young children at home that they should stay in the hospital, but then the insurance refuses to pay for the inpatient stay, what happens to them in your own practice?
The hospital thing, yes. So we've had scenarios. This was not a young child. Well, this is actually like a grandparent, and of course there's young children, and they were caregivers for them. So we had financial assistance in our kind of university practice help the patient out for this scenario. So I think, if your insurance, and we can write appeal letters to the insurance, but if they're not covering it, ask your the group that you're working with if they have financial assistance for this reason. So it took a little while for us to arrange that, but that's been my experience with that scenario.
When you say a high dose, do you mean over 200 millicuries?
Well, yes. So a high dose, I would mean over 200. Usually we would want hospitalization. Now, between 150 to 200, I mean, so the high means anything that's technically, if you had a very low risk cancer and you're getting, anything bigger than 100, 125, it's probably more than needed. But between 150 to 200, we're not sure. The risks of these kind of saliva side effects, increased risk of cytidinitis start happening above 150, definitely above 200. So I would say above 200 is high. Between 150 to 200 is kind of moderate high. 30 is low, and then between 30 to 150 is kind of intermediate. So it's a huge range, I know. From a side effect standpoint, more than 200 definitely high, more than 150 possibly high.
Do we need to get up every hour on night one to do the saliva stuff and eat candy for the saliva? What if I sleep through my alarm? And that question might be originating from Dr. Van Nostrand, who said that we should get up every hour and suck on candies or salivate.
So, well, I don't think you need to keep getting up and set an alarm. I think, if you think you're going to sleep for 9 hours, then maybe waking up at least one in the middle, 4 to 5 hours later, having some fluids and having that kind of candy is okay. But if you're sleeping 6 to 8 hours, I'm hard to kind of recommend to keep getting up every hour. There is no study to support that. We don't have a group of patients who we subject to this versus other group we say, well, you can sleep normally and see 3 to 6 months later higher or lower risk. So none of this is without any data, is with any data to support it. So I would say if you are someone who already has very dry mouth, and then maybe okay to wake up maybe a couple times at night and have the candy and liquid. But if you had a lot of liquids before going to sleep, the problem is if you have a lot of liquids, you are going to wake up in 4 hours to pee, right? So this question may be moot. So usually people will wake up in 3 to 4 hours. I personally don't think you have to wake up every hour for this if you've been doing okay during the day. Now, during the day, say you were so tired, you forgot to drink, and you're like, oh, now it's nighttime, I haven't kept hydrated. Well, then you've probably put yourself in a scenario where you need to keep drinking and peeing through the night.
So this is a clarification question. Are you supposed to wash everything exposed to sweat or fluids for 2 weeks or 5 days? They lost track during the presentation.
Yeah. So definitely for the first 5 days, I would say to be on the safest side, that 12 to 14 day or the 2 week time period, we do want to make sure that the kind of distance from children and similar things is maintained. Now, this 2 week is the upper limit. Okay, most people will need it for maybe 10 days. Usually when we do that post-therapy scan, the radioiodine scan at the 5 to 7 day mark, we can kind of give people a little bit of guidance that you need maybe for a couple more days or not. So first 5 days is very strict because you're going to be releasing all of that radioiodine. I personally think, because we are not 100% sure about, maybe there's a little bit, maybe something like that. So at that 2 week mark, if you kind of just clean everything that you were using in sheets and all, towels, I think that's a good practice. Definitely do it for the first 5 to 7 days. And as you know, we're not going to have a research study to evaluate this because, yeah.
There's two questions here related to exercise. I'm going to combine them. Would you recommend exercising after treatment during isolation to try and excrete more radiation and for mental health? Or is it too risky to sweat that much? And then this other question on the same topic, do you think there's any benefit to doing exercise, increasing the heart rate and the blood flow after taking RAI to encourage RAI to get everywhere in the body?
That's a good question. So I think if you're someone who doesn't, there are people who sweat very little. And so exercising can increase the amount you sweat. And so similar thing is, we're asking, try to salivate more, sweat more, keep hydrated and pee out more. So if you're someone who sweats very little, one of those lucky people, I am not that, then I think maybe it helps if you're not going to sweat at all, right? But otherwise, most of us will sweat a little bit. I don't think you have to exercise for that reason. Now, for mental health, yes, I think, you're kind of isolated. There's not much going on. Some amount of exercise is okay. The issue is that if you're depending on the radioiodine timing, right? If you had a neck surgery and it's been maybe 4 to 6 weeks, sometimes even up to 8 weeks, but maybe you had slightly more extensive surgery or you had maybe some complication or you have other illnesses, then you do want to do it gradually, right? And that's your surgeon will tell you, okay, the scar is now kind of fairly, it's like had that enough tensile strength that you're not going to split it open. Yeah, then you can start it. Most of us are probably not lifting heavy weights in the first 2 months after the surgery, but we're starting to do some cardio, etc. So I think it's very reasonable to do that. I think the radioiodine does go to the thyroid a lot and a little bit to saliva glands as well. So I don't think that you need that exercise related blood flow for it to go to places and be absorbed or it to be the rest to be excreted well. I think that happens by itself. So you don't need exercise for that, but I think it's very reasonable to do some, making sure your neck scar and things like that are okay.
I don't know if you're familiar with the website inspire.com, but someone on the thyroid group there suggests that if you have a shared wall where you lived, you tell the person, because the radiation goes right through the wall after you have the treatment. What is your belief about that?
I was actually not aware of this, and it may be the thickness of the wall. At least where I live, we have enough thickness in the wall in between, but it is possible if you have a very thin wall between two places and say your bed is right there, their bed is right next to it, then technically it is possible. I would just recommend in general, if you have neighbors living close by, they should probably know. Otherwise, they may come up and be very close to you or something, or they run into you in the hallway or something. But this is a good thing. I'll have to look into it as to how much distance through a wall that it can go. Technically, if it's less than 6 feet, then maybe they should know.
Also, I'm wondering, I did develop after my second treatment, the dry mouth, dental problems, and the salivary problem. So I'm on a prescription toothpaste that has more fluoride. If I have a third treatment, should I stop that extra fluoride toothpaste?
It should no. The fluoride by itself should not affect your iodine uptake. Now you may just need a milder toothpaste in general, something that dries out your mouth less. And usually with multiple treatments, there's sometimes we do talk about some of these cholinergic agents. There's not good studies to support it. Something like amifostine has been tried, like it may increase salivation, usually not needed after someone's had a treatment once or twice, but maybe you're saying if it's multiple times, that could be something to consider. So cholinergic to increase salivation more. There's a 1 or 2 studies that really didn't show much of a difference, but there are some cases, anecdotal cases there, where especially if you've had issues with saliva and you're getting multiple treatments, then it may be useful. So that's something to ask. Usually our head and neck surgeons and our surgeons would be the ones prescribing that. Also make sure that you don't have any blockages of a saliva gland. So sometimes they'll want to do like a salinoscopy or check to make sure if you've had some blockages, they probably want to clear them before or even like early on after while they're giving you the treatment, if you already had some issue.
So we're down to our last 2 minutes. I'm just going to ask Dr. Kotwal if he's got any closing remarks.
Yeah, this is always tough, closing remarks, because I kind of go on tangents all the time. I would just say, as you've heard, that there is not a lot of definitive answers here, right? And some of it is perception as to, yeah, most people want to be more safe than not, right? That's our usual personality. So that's why some of these things come up. Okay, most you need it for 5-6 days, but maybe do it for a little bit longer. But you don't have to go completely bonkers trying to like clean everything for more than 2 weeks. So I would say that's kind of the upper limit there. At the same time, the low iodine diet, do as much as you can. Don't have iodines containing salt and a lot of canned foods. And then do as much as you can in learning about it. I usually encourage patients to know more, because I think the more we learn, even if we, depending on what we do, we just feel more empowered, and we usually tend to have better outcomes in general. That's what I feel. And so that's why we encourage people to know. But if at some point it is appearing that's actually worsening your quality of life, or you're just getting too overwhelmed, then it's okay to kind of, take a minute, relax, and then ask people. Go to the websites, go to the, support groups, and see what maybe other stories are, or what is out there. That's I guess what I'll say.
Awesome. Thank you so much, Dr. Kotwal. This is truly a wonderful session. Lots of great information. And thanks everybody for our virtual audience and our in the room audience for great questions. Take care and have a great rest of the day. I hope you enjoyed conference.